Oh, there's more Colonnade folks dialing in. Hi, Darlene. How are you? And Barbara? Good, good, good. Diane, good to see you. Thanks for joining us today. I think we probably want to get started just to be mindful of everybody's time, because I know that it's a busy time for everybody. And I do see that Dr. Chung is on with us too. So Dr. Chung, with your permission, I'm going to go ahead and get started. I'll make a few opening remarks. I should say I'm Gina Orr, Chief Philanthropy Officer at Sun Health Foundation. I've been chatting like everybody knows me, and that's not always the case because we have wonderful new people zooming in today. So we sure appreciate that. And I said that we have people in the conference room at La Loma, and so I'd love to see all of you there. We'll be taking our Coffee with Gina and Friends on the road, so we'll be hitting different locations in the future. So today we're talking about back, and if you have an aching back or you have some migrating pain from that for something else, I think you're in very good company, because we hear a lot about, oh, my aching back, what can I do about this? 80% of Americans experience some kind of back pain in their lifetime. So this is, it's something that's difficult to manage because pain can impact your sleep. Sometimes you can't sit, you can't stand, you can't walk, you can't get comfortable. So again, you're in a good fraternity here if you have back pain, but it's not necessarily one that we want to be in. So I know I used a double negative there, but you get my gist. So I guess we're going to talk a little bit how to manage those symptoms. How can you eliminate the back pain? What are the non-surgical treatments for back pain? And I think we're going to hear some great information today. And I guess the biggest thing is, when is surgery really warranted? Because we know that when you go through surgery, there's always side effects to that. And it's not always something that is always, the answer to nearly everything. So how do we protect our backs in the future as well? So many of you, oh, hi, Sandy, nice to see you. Thanks for coming. Just as an FYI, for those who are new, we'll keep you all muted so that we don't have feedback while Dr. Chung is speaking. And Dr. Chung wants to make this interactive. So as he's talking and sharing information, if you have a question, if you have a comment, if you have an inquiry, wave your hand and Joyce can unmute you, or we can guide you to unmute yourself to ask the question during the presentation. So I'd like to, Dr. Andrew Chung is the spine surgeon at Banner Health, and he's one of the few double fellowship trained surgeons in Arizona. Double fellowship trained in Arizona, which means he's had a lot of school. He seems very young, but he's had a lot of school. So it's really, if you take a look at his webpage, he's really all about education. He has a wonderful quote that I hope I can share with you. He says, "I take a very holistic and conservative approach to spine surgical care. I treat every patient as a family member or close friend and always view surgery as the last resort." Now, I think that's a lot to celebrate. So we are very fortunate to have Dr. Chung with us today. And I'll go ahead and mute myself so we can get started into this interactive discussion with Dr. Chung. It's my pleasure to turn it over. Dr. Chung, are you ready?
I'm ready. Thank you, Gina. Thank you to the Sun Health Foundation for inviting me to speak this morning. I do have my coffee here, so I'm ready to go. And I'm going to share my screen here. Just as a primer, even as spine surgeons and spine physicians, we're still figuring back pain out. So it's still a bit of a mystery even to us. And what that means is that it's still an imperfect science. So a lot of what I'm going to present to you is kind of based off of kind of the latest about what we know regarding back pain and kind of the management of back pain. And probably more importantly, maybe the prevention of back pain. But again, we're still figuring it out. So again, thank you guys for tuning in and for giving me a few minutes of your morning here. And just in case, I didn't realize my wife was going to leave me at home here. I'm actually off for the day, and I'm home with the kiddos, and I didn't realize she was going to step out, and so they may make themselves known, but hopefully not. I've given them some snacks and turned on some good TV for them. So
hey, Dr. Chung, could you
That was a little unexpected. So
yeah. Dr. Chung, could you swap
Swap your view.
view?
On the top. It's on the very top. It says.
See, it's on the very top where it says view. Can you swap the view? That'll give us a better look.
Swap to the left.
Swap to the left.
or maybe what it is I'm connected to my monitor here. Does that make it better at all?
He just goes and clicks it off display.
Tell it to
Use slideshow.
you see the slideshow.
Oh, I see. Yeah. I see what you're saying.
There you go.
There we go. Thank you.
All right.
Okay. Thank you.
So let's get started. So where does spine pain come from? So when we talk about spine pain, we're talking low back pain, mid back pain, even neck pain for that matter. And before we kind of, dive into that, we really at least need to have a basic understanding of the anatomy of the spine. And so when we look at the spine, or what we call the vertebral column, it's essentially this long structure that consists of all these kind of bones or building blocks called vertebrae. And then in between, we have these little cartilage structures called discs. And discs are really kind of where, when we talk about arthritis, and we'll talk a little bit more about what arthritis is on future slides here, but it's the wearing out of the discs that we're talking about. And it happens to, unfortunately, all of us starting at age 20. But the function of the spine in general is to keep us upright. It supports the weight of the body. And then very importantly, it protects all the electrical system or the entire electrical system of the body, or nerves. So the nerves actually are living within the spine. And that is a very important function of the spine, to protect those guys so that they're not getting damaged or beat up. So what do those nerves do? They basically allow us to move our arms, feel our arms, move our legs, feel our legs, even control our bowel and bladder function. So I think there was a question via email, can a back problem cause neuropathy or nerve pain? And the answer is yes, but it's not as simple as that, because there are other causes of nerve pain as well. But the short answer is yes. Spine issues can cause neuropathy, or what you guys may know of as sciatica, or pain going down the leg or arms. So in general, what causes spine pain? Believe it or not, the majority of the time, it's actually irritation of muscles and ligaments. And you can see here on the right side, we have some nice kind of pictures of the anatomy of the spine. And there's a lot of muscles and ligaments that surround the bones and the discs. And again, most of the time when we have back or neck or mid back pain, it's actually irritation of all these muscles. And we're going to talk about why strengthening of these muscles is so important to the management of spine pain. But if I can kind of, introduce you to this idea, it's because we have so many muscles and ligaments in our spine that can get inflamed, that exercise and core strengthening can be very beneficial for the treatment and management of spine pain. And then kind of the remaining spine pain is due to what we call degenerative or arthritic condition. So what do we mean by arthritis? The technical term for arthritis in the spine is what we call degenerative disc disease. And the idea here is that starting at age 20, our discs start to wear out, unfortunately. And this can lead to disc bulging. This can lead to the formation of bone spurs. And again, if we go back to kind of what the function of the spine is, not only does it keep us upright, but it protects all of our nerve structures. And there's only limited space for those nerves. So if you have disc bulging and bone spurs that start to kind of crowd those nerves can get pinched, and we call that stenosis. So these are all terms that you may have heard or be familiar with. But really, in the vast majority of cases, nerve pinching is actually the result of arthritis. And that can lead to both kind of neck, mid-back, low back pain, but even, again, pinched nerve pain or pain going down the leg or arms, again, what we call sciatica. Now, the truth is, again, I keep saying it starts at age 20, right? We all get arthritis starting at age 20. And I'm not making these numbers up. They've literally done studies, and these studies have been published in some of our best kind of spine journals. It's what all the spine nerds read. Basically, they did these studies in people that had no pain. And what they found was starting at age 20, 30% of us already showed signs of arthritis based on X-ray or MRI. At age 60, 90% of us had arthritis based on X-ray or MRI. And the most interesting thing to me here is that between the ages of 40 and 60, about 60% of people had what were considered severe findings, and again, had no pain at all. So I think the important thing to keep in mind here are that MRIs are oftentimes scary. You're going to get your MRI report, it's going to show something, but it doesn't necessarily mean that something scary needs to be done for it. So I just want to kind of put this in your mind. Importantly, if you get an MRI, obviously it's important to discuss the results with a physician or surgeon, but again, we all get arthritis, so just remember that. And it starts at age 20. And in general, it's not a dangerous condition. So for the treatment of spine pain, and this really goes for kind of first-time spine pain, or maybe you've had spine pain in the past and it's kind of flared up again. In general, for kind of the first 6 weeks or 3 months of kind of that initial spine pain or flare-up, really you should try to avoid any sort of procedure and certainly surgery. So these are kind of, the different things that are very helpful in the treatment of spine pain. So physical therapy or yoga. And the idea there is, again, you're building up those muscles that oftentimes are the pain generator, and you're getting them to kind of calm down, if you will. Motion is lotion. So the more you move, believe it or not, even though initially it may hurt, the less pain you're going to have. And the science is pretty clear about that. Maintaining a healthy weight, trying to get as much sleep as possible. People that kind of deprive themselves of sleep tend to have more pain in general. And then ergonomics, so kind of how you move about your day actually affects the amount of pain that you experience. And we'll talk a little bit more about what that means in kind of upcoming slides here. And again, I'm not making this stuff up. The body really has the ability to take care of a lot of these kind of, episodes of spine pain that you have. And again, some of our best data shows this. So 70 to 90% of people with neck, low back pain, even pinched nerve pain are going to be better in 6 to 12 weeks from the time of onset. And again, it's because our bodies have the ability to take care of this. So many of you are probably wondering, well, okay, that's great for the person that's, had pain for the first time, or maybe every now and again gets some back pain, but what about people that continue to have back pain? And really in this case, prevention and management are very important. And what I mean by prevention is if you have back pain, we want to prevent it from obviously getting worse. And so the analogy I oftentimes use, and I think this makes sense to most of us, right? If some of us have had a heart attack, or somebody that's had a heart attack or a stroke, what are you or what would you expect that person to probably have to do to kind of prevent that from happening again? Well, it comes down to kind of daily habits that are healthy to kind of keep that heart healthy, keep the vessels in the brain healthy. And again, it's the daily management that we kind of encourage to prevent those things from happening again. So eating a healthy diet, maintaining a healthy weight, trying to be active, avoiding kind of, bad social habits, if you will. And it's the same thing when it comes to spine pain. I think of your kind of first episode of back pain as your first kind of back attack. And you got to do everything now to really prevent that from happening again. And so how do you do that? Again, it goes back to kind of these non-surgical options here. So again, building up those muscles, doing your daily core strengthening, whether with a therapist initially, and then kind of doing it on your own, or doing yoga. Again, trying to stay as physically active as you can. Again, motion is lotion. Try to maintain a healthy weight. The less work your spine has to do, the less load is on your spine, the less it's going to hurt. And that's true of any joint in the body. Again, trying to manage your sleep habits, trying to sleep better, and then ergonomics, which we'll talk about here shortly. Again, to prove to you the importance of the core muscles, or the muscles that are kind of surrounding the spine here. This image to the left is actually kind of a bird's eye view of the spine. So I don't know if you can see my cursor here, but here is your spine. And then all of these kind of dark structures here that are kind of labeled those are your core muscles. So typically when people think of core muscles, they think of the six pack. It's really not the six pack. It's the muscles that are directly encasing the spine. And so the idea here is if you kind of build those muscles up, and for one, if they're a source of pain, oftentimes, and you make them strong, one, they themselves are less likely to get injured or hurt. But if the spine is truly the source of pain, well, build up the things that help support the spine, which again are the core muscles. And that's not an overnight process. That's not 6 weeks of, or 6 sessions of therapy. That's daily commitment. I oftentimes tell people that, there's no easy or quick fix for back pain. You gotta put the work in. It's a marathon. It's not a sprint. So oftentimes I get patients in my clinic who are like, well, yeah, I tried therapy. I went to 2 sessions and it made me worse. Well, my answer to them is, well, of course it's going to make you worse. I mean, it's like if you're training for a marathon and you haven't run ever, and then you go run, for a mile, the next day you're going to feel sore. But eventually, if you keep up with it, you will get there. And it's not to say that therapy is magically going to, or core strengthening is magically going to get rid of all of your back pain, but I can guarantee you it will help in the long run. What is kind of this idea of ergonomics? Well, posture, kind of even how you sit. If any of you work at a desk, how you position your keyboard versus your monitor, all of these things matter in terms of the management and prevention of spine-related pain. And a good physical therapist, honestly, can kind of walk you through this. But again, posture matters, ergonomics, when you lift things matter, even where you place things around the house matter. So if you oftentimes are in the kitchen or working in the garage, if there's something that you're using more commonly, put it at eye level where you can easily reach for it. Don't put it on the bottom shelf where you have to constantly bend down for it and risk potentially irritating your back by the end of the day. So these things actually are good management strategies to prevent you from getting more pain than you already have. So again, this is kind of an illustration of that. Put things between, that you're going to use more commonly between your shoulder and kind of waist height. So you're not having to bend down or reach up for things repeatedly, because that will irritate not only your low back, but when you're reaching up and you're looking up constantly, you're going to irritate your neck too if you have some arthritis there. So kind of in brief summary here of what we've talked about so far, everybody gets arthritis. Spine pain is common. To Gina's point, 80 to 90% of people get it at some point in their lifetime. It's the second most common reason for a doctor's visit. But most importantly, it's not dangerous most often. And again, remember, in order to really manage spine pain well, it takes daily commitment. It's a marathon. It's not a sprint. There's no quick fixes for spine pain. Now, that being said, there's a reason why I have a job, right? I keep talking about the non-operative management of spine, and I will say that in most cases, it is very successful, but there is a reason why I have a job. So let's talk a little bit about when spine surgery is actually warranted. So I think all of us will agree in the medical field and those of us who do spine surgery that if you have a spinal issue that's resulting in a nerve being pinched or the spinal cord being pinched and it's leading to weakness in somebody's arms or legs or inability to walk or inability to go to the bathroom, I think most of us would agree that this is a situation where we have to offer surgery. It's my job to protect your function. I want to keep you walking. I want to keep you being able to use your hands. So in these situations, spine surgery obviously is 100% warranted. What about for pain? Typically for pain, surgery is most successful and most predictably beneficial in the setting of pinched nerve pain. So if you have a pinched nerve in the back or the neck and it's causing pain going down the arm or the leg, and you've tried, all the kind of non-surgical things, then surgery can be very effective. Interestingly, again, this kind of goes back to my point that we're still kind of figuring this out. We're still an imperfect science. For spine pain alone, whether isolated neck pain or isolated low back pain, surgery oftentimes is not a great option. And again, it just goes back to the reason that I mentioned before. We just don't have it all figured out yet. So many of you probably know somebody that has had spine surgery and maybe got worse or never got better. Again, it's because we don't have it fully mastered yet. Now, in between surgery and kind of non-surgical means, you can also consider injections and different pain management strategies. Oftentimes, these things can be temporary, but again, maybe if it prevents you from needing some sort of major surgery, it can be an effective strategy. Now, this kills me, because I hear this all the time. Spine surgery made me worse. Spine surgery doesn't work. Avoid spine surgery. I kind of agree with the last one, but I will say that there is some truth to kind of those first 2 points, and mainly because when you really look at when kind of modern day spine surgery has taken off, it's been in the last 5 to 10 years. So our techniques and our understanding of when, and more importantly, when not to operate, have really improved in the last 5 to 10 years. So in the defense of the surgeons that were doing these surgeries back in the day, not too long ago, and didn't have great outcomes, they just didn't know any better. But I will say that for the right reasons nowadays, spine surgery can be very effective. The other thing to keep in mind is if you are considering spine surgery, make sure you go to a spine surgeon that understands how to look at the big picture, right? Because pinched nerve pain can oftentimes cause pain going down the arm or pain going down the leg. And sometimes that can be mistaken for, or rather, extremity issues can be missed because it's thought to be a pinched nerve issue. And I've seen that, unfortunately, where a patient came in, they've had surgery for their back or their neck, because they had wrist pain or knee pain or ankle pain, and they never got better. And lo and behold, you examine the patient, and at the end of the day, it was never the spine. It was the hand, it was the knee, it was the ankle. So my only point is make sure that whoever you're going to see understands how to look at the whole picture, and you'd be surprised, not everybody does.
Dr. Chung,
Yes, ma'am.
may I please ask a quick question here? And it's
Sure.
kind of related to what you're talking about. It reminds me that one of my neighbor's daughters who lives in Colorado has been having some problems with intermittent numbness of her fingers and even of her ability to kind of turn, and she's young, she might be 50, I don't know, the daughter, maybe 40.
Yeah.
But they seem to relate this to she had gone to a chiropractor who was perhaps too aggressive. I don't know that for sure. That's their assessment. But she noticed that after this session with the chiropractor is when she had this neck issue and this intermittent thing about the numbness of the hands and the inability to move. And I don't know, maybe she was kind of just ripe for that kind of response to an aggressive chiropractic treatment. Do you see things like that as a result of a certain kind of exercise or massage or chiropractic treatment, that just is what prompts some of these other symptoms?
Yeah, no, we do see that now. I tend to I try to keep an open mind. And I think it's just kind of virtue of my path to medicine. So, I guess what I'm trying to say is, I think that there is a beneficial role to, chiropractic care. But that being said, absolutely, I do see instances where somebody had an underlying issue in their neck and their low back and underwent, too forceful of a manipulation, and then now, have kind of worsened pain or new symptoms that they may not have previously had. So it's not to say that, you shouldn't be doing those things. In general, I tell people to kind of avoid the forceful manipulation of the neck, unless you've got a really good chiropractor that is a little bit more gentle. But I've seen some that really just twist, and to me, that's a little kind of dangerous and scary. For the low back, I think it's less of an issue, and there actually is some data to show that chiropractic care can be beneficial for kind of the management and treatment of spine pain. So Again, I'm not completely against it by any means, but certainly to your point, I have seen where treatments have led to worsening of symptoms or new symptoms that may not have been there prior.
You know, interestingly, we were able to get her hooked up with a massage therapist who specializes in post-surgical or post-trauma massage, and even does some lymphatic stuff. And I think she's getting some relief from that. You know, I had rotator cuff surgery a couple years ago, and she was helpful with breaking up some of the scar tissue on that as well. So I think choosing the modality to correct an issue, to your point, you know, just don't automatically assume that you're going to take drugs or get an injection or whatever. I think consulting with a professional such as what you're telling us today is really key in managing all of this.
Yeah, no, I agree. You know, I don't think we have all the answers yet. And so there are things that don't necessarily have the data to back them up. But clearly they seem to work for people, you know, kind of case in point is like acupuncture.
Yeah.
You know, my father, he was a physician. He worked for the VA in Connecticut, and he dealt a lot with patients who've been in chronic pain and who have kind of tried everything, you know, weren't surgical candidates. He learned how to do acupuncture. And I mean, I saw there was a line out his door because for those people, they thought it was very beneficial to them. But if I go to the science right now, I'm not going to find any hard data to show that acupuncture really makes a significant difference. And so I guess my point is I think we're still kind of figuring some of this stuff out. But as long as it's not a dangerous modality, as long as it's working for you, I'm okay with it. I have nothing against, you know, chiropractic, you know, massage therapy, lymphatic drainage, acupuncture. Most importantly, you need to feel comfortable with it. As long as it's making a benefit to you and probably more importantly, you can actually afford the treatments, then I don't think there's anything necessarily wrong with some of these other modalities that exist.
Thank you.
So again, for the right reasons, spine surgery can be highly effective, but in general for pain, it should be considered a last resort. So let's just kind of briefly talk about some of the new technologies or techniques that exist, because there's a lot of marketing in this regard, as you guys probably have seen. And then like stem cells and, platelet-rich plasma or PRP is very highly marketed as well. So let's talk about, kind of what the evidence behind some of these things are and whether or not they're potentially worthwhile to consider. I will say this though, in general, new does not always mean good. And so if you look at kind of the history of even, spine surgical techniques that have kind of come into popularity, but then quickly fallen out of popularity, what it basically means is that just because something's new doesn't necessarily mean that it's good. There's a lot of things that have been done in the history of spine surgery that are no longer done because even though they were new, very quickly they were proven not to be the best thing for you. So just something to keep in mind. Minimally invasive spine surgery is something that's kind of highly talked about. Everybody markets themselves as a minimally invasive spine surgeon nowadays. But what is it really? Is it just smaller surgery? Right. Again, we're all marketing this. Even if you go to my website, I market it. But the truth is that there is significant benefit to it, as we'll talk about. But let's talk about why minimally invasive surgery is even beneficial to begin with. And really, when you kind of look at what led to the development of minimally invasive spine surgery, the kind of early kind of pioneers basically thought to themselves, well, when we're doing these classic spine surgeries, we're destroying a lot of muscles, we're destroying a lot of normal anatomy. And most importantly, we're destroying this muscle, one of the most important core muscles of the spine. And what the idea was is, well, if we preserve a lot of these kind of normal structures, would not people do better? And so that led to kind of the genesis or the development of minimally invasive spine surgery. The idea is to better preserve the multifidus muscle, or some of the kind of most important core muscle of the spine. And so this is maybe a more dramatic picture of what a traditional open surgery is, but it just kind of gives you an idea of how potentially destructive this can be. You're opening up the spine, you're kind of filleting open the spine, all the muscles are getting destroyed, all the ligaments are getting destroyed. And just as a caveat to what I'm about to say here, there are times when we absolutely have to do this. And I will say that a well-trained traditional spine surgeon still can have very, very great outcomes. My only point is just that with everything else, if, there's a reason why we use, computers nowadays versus typewriters, right? So there needs to be some sort of evolution of getting better. And we do have some techniques that are much better now than some of these traditional approaches, but it's not to say that these things are absolutely outdated or can't work. But I think you guys can agree, when your spine looks like that after surgery, that's a lot of destruction that went into doing the surgery. The idea behind, again, minimally invasive surgery is that we're kind of taking advantage of corridors between muscles and using kind of specialized retractors so that we're not destroying all of these muscle structures. And ultimately what that leads to is less collateral damage. So the way that I look at this is it's almost like a sniper shot, right? It's very precise. You're taking care of the problem that needs to be addressed with very little collateral damage versus the open surgery. And so what that leads to, and sorry if these pictures are too grotesque, just turn the other way for a few minutes here. But what this ultimately leads to, and the data is pretty clear on this, is this leads to a faster recovery. It leads to less pain and less narcotic use after surgery, less complications, and potentially improved long-term outcomes. The early studies show that this may be the case, but admittedly, we still need some more data to show that in the long term, this really makes a difference. But definitely in the short term, there's no question, everybody will agree that it's better than the traditional approach. That being said, just because it's a minimally invasive procedure doesn't necessarily mean it's good. So again, new does not necessarily mean it's good. It still needs to achieve the same result as an equivalent conventional surgery. So just as a quick aside, just make sure the person that's doing this minimally invasive procedure is actually fellowship trained in spine surgery. There's a lot of people, unfortunately, that market themselves as surgeons or minimally invasive surgeons when they really truly don't have the appropriate training to do it. And it's unfortunate, but that's the reality of what our healthcare landscape is today. So who can actually do spine surgery? So orthopedic surgeons that are fellowship trained in spine, like myself, or neurosurgical surgeons that are fellowship trained. The bottom line here is it takes more than a quick weekend course to perform spine surgery well. So be careful of, quote unquote surgeons who are not actual surgeons. They just don't understand. They don't get the training to do this effectively for you. So that's all I'll say about that. But moving on to platelet-rich plasma, stem cells, what's the deal here? Is there evidence for it? First of all, what is platelet-rich plasma? Basically, we take your blood, we spin it down, and then we take out the platelets, which are these kind of small cells that are important for not only blood clotting, but also the healing process. And so the idea here is that if you kind of leverage the benefit of platelets, maybe you can, heal a diseased tendon or irritated muscle, potentially maybe improve arthritis. So that's the idea behind using platelet-rich plasma for the treatment of different pains throughout the body. What about stem cells? Stem cells are cells that are capable of becoming a brand new cell. So the idea here is that, if you've got a bad knee or a bad shoulder or potentially a bad spine, you take a stem cell, you inject it into that knee, and it grows into something good, right? That's the idea behind stem cell therapy. The reality is that the stem cells that we actually are using in the clinics are actually not true stem cells in the sense that they are not embryonic stem cells. So embryonic stem cells, basically, stem cells from a placenta or, an embryo, really have the best capacity to become whatever kind of cell, we want it to become. current stem cell therapies that we use in the clinic really are what we call minimally manipulated adult cells. So basically, you harvest some of these potential stem cells from blood, bone marrow, and fat, and then you inject it into different areas of the body, hoping for a positive response. There is good data to show that in certain applications, PRP, even stem cells can be effective. So for like tennis elbow, different kind of tendon issues, PRP can be very effective. There's even some studies to show that in mild to moderate arthritis of the knee, or even the shoulder for that matter, stem cells can be effective. But you got to make sure that you're going to somebody that knows what they're doing, because there's a lot of factors that can affect the effectiveness of stem cells or even PRP. There's like 10 different machines that prepare stem cells and PRP. So you got to make sure you're going to somebody that actually knows what they're talking about, because unfortunately there's a lot of people that are advertising that they are a regenerative clinic or do stem cells, but don't really truly understand the science behind necessarily what they're doing, but they'll take your money, and just be careful of that is all I'll say. In the spine, we're not there yet. I think we will get there, but there's no clear data to show that in the spine that the benefits really outweigh the potential harms of injecting these different therapeutics in the spine. One of my mentors, one of the guys that I trained with, he owns a stem cell research lab. And so he has every financial incentive to say that stem cells work, but he'll be the first to tell you that we're not there yet in terms of stem cell treatment for the spine. So hopefully we'll get there, but as of right now, at least in the spine, probably not a good idea. And I know that this can be frustrating for some of us. The easiest way to kind of think about all of this is that, when it comes to different medications, like let's say aspirin, right? I think we all can admit that, aspirin that's a Walgreens brand versus, maybe by Equate, they're probably going to be pretty similar. But not all platelet-rich plasma, not all stem cells are the same. Again, there's different machines that prepare, these things in a different manner, and there's a whole science to that. But in reality, what it comes down to is this nice lady, she loves her smokes, she loves her drinks. I can guarantee you that her stem cells that are harvested from her are not going to be as effective as this vibrant individual who's eating a salad, right? So just something to keep in mind. And so really what it comes down to is this, when people ask me about, the effectiveness of stem cells, I really kind of think about it like this. Is it something that I would recommend to a family member? I think if you've got the money to burn and you don't mind just trying it, I think it's not unreasonable. But if you don't have $15,000 to $20,000 laying around to spend on stem cells, I'd probably look the other way and look for other alternatives. Again, I think there is opportunity moving forward for us to get better with this, but we're not quite there. But if you are going to consider it, make sure you go to somebody who has a lot of background knowledge on this and is doing this in a scientifically based manner. So in summary, everybody gets arthritis. Spine pain is common. Again, prevention and the management of back pain or spine pain is key. Remember that the body to some degree has the capacity to heal itself. For the right reasons, spine surgery can be highly effective, particularly with kind of the newer minimally invasive techniques, but in general, for pain should be considered as a last resort. I can always make you worse, right, with spine surgery. That's the reality. But again, for the right reasons, it can be very effective. And remember, there's no easy fix for spine pain. It takes daily commitment in most situations to really kind of get a hold on spine pain and keep it well managed. Thank you.
Very, very nice. I really learned a lot. I do have a question as we open it up to everybody else as well. I guess, managing the symptoms and the pain is a very individualized personal thing. Some people might find that a jacuzzi works, others might find that a cold pack works. And so I guess, it's the tried and true techniques on what works best for you is really the best route. There's really no, like you said, no silver bullet to make this go away.
No, there's not. I mean, again, the kind of the three kind of most consistent strategies to best manage spine pain are daily core strengthening, trying to stay as physically active as you can. I mean, this is data driven. The science is pretty clear. People that are more physically active tend to have less pain, whether it's spine pain, joint pains. It's a real thing. And then trying as much as possible to adopt kind of healthy eating habits and social habits. So if you're a smoker, stop smoking. If you drink a lot, maybe cut down, try to maintain that healthy weight. And then, as to your point, everybody's plan otherwise is going to be somewhat individualized. If you find that acupuncture works for you, there's no harm in that. Go do it as long as you can afford it and it can afford the time. And if you feel that massage therapy is the right answer for you, go do it. There's nothing wrong with that. So yeah, I think we're still figuring some stuff out, but those three things are certainly things that should be a part of your kind of daily management routine.
Thank you. I also found it interesting, Dr. Chung, that your friend who has a stem cell research lab, and he has every incentive, financially incentive reason to really market that, because I have heard physicians say for stem cell therapy in many cases that the marketing's ahead of the science. And it was interesting for me to hear you say, particularly as it relates to spine, we are just not there yet. So, Elon Musk might have money to burn for something like that. But that was a great slide, by the way. We were all laughing. Yeah.
No, and again, I think we may get there, but it's not even that we may get there. We will get there eventually. We're just not there yet. And it's unfortunate to see, though, when I see people that come in and they've dipped into their savings to get a stem cell treatment and didn't make them any better, and they've paid, now they're short 20 grand, and they're no better than where they were to begin with. So my only point is that if you are going to consider it, just make sure that, one, you can afford it, because it may not be something that you're going to get what you think you're going to get out of it. But there's nothing necessarily wrong with trying it otherwise, if you can afford it.
Yeah. Well, thank you, Dr. Chung. Are there any questions from any of our guests who've dialed in today? Any specific? Sharon Eagleston has a question. Can you unmute and ask Dr. Chung what you'd like to know? There you go.
Yes, thank you. That was so interesting. Could you talk a little bit about medications? I'm on a blood thinner and I can't take NSAIDs. So what might a doctor prescribe for me because I can't take NSAIDs?
Yeah, it's a great question. And in general, I don't know what other medications you're on, but in general, you're right. I mean, NSAIDs are really kind of the mainstay of, the treatment of arthritic pains. And even then, just as, side, I know you can't take them, but just for kind of to be comprehensive here, when I have people take them, I usually tell people to take them sparingly. And so the strategy there typically is, take it for a few weeks, consistently, if you have a flare up or if you have new pain, and then give your body a break. And then while you're taking it, make sure that you're drinking fluids, you're taking it with food, because the main side effect of NSAIDs are that they can potentially damage the kidneys and also cause stomach ulcerations and things like that. And so it's certainly not anything that we want you on long-term, but a good strategy is take it for a few weeks, give your body a break. If if it comes back again, if the pain comes back again, same thing. Or alternatively, if you're going to go out and do something that's going to aggravate your spine, maybe a lot of you like to golf or like to hike, and that when you do 2 rounds of golf, your back gives you some troubles. Well, maybe that day, and the next day, take some anti-inflammatories, and that can be a very effective management strategy. Now, as far as for people that can't take anti-inflammatories, In general, Tylenol can be pretty good. Extra strength Tylenol, 500 to maybe 1,000. Again, something to kind of discuss with your primary care doc who, manages your other medications. And certainly if you're drinking alcohol too, you don't want to, be taking too much Tylenol, but that's an alternative. There are some more kind of natural anti-inflammatories. Again, something to discuss with, your cardiologist or your primary care. But turmeric powder with black pepper actually comes in a capsule formulation now. And it's been shown in the science to be as effective as ibuprofen for the treatment of kind of inflammatory, basically like arthritic conditions. But it does still have a little bit of that NSAID side effect profile. So I would just, again, clear that with your primary care or your cardiologist. Beyond that, you're looking at different narcotic medications like, maybe tramadol, not great options, but certainly, when the going gets really bad, not unreasonable to take, 1 or 2 of those here and there. But ideally, if you can minimize the medications that you're on, particularly the narcotic medications, the better it'll be for you. There's some newer data to show even, a little bit taboo, right, to talk about weed and cannabis, cannabinoids. But there actually is some newer data to show, and this is kind of a hot topic in orthopedics and spine, hey, well, is there any merit to using CBD, creams and oils to kind of help with the management of pain? And there is some early data to show that it can be effective as well. So that's another alternative as well.
Thank you.
Is Celebrex just taken like another NSAID that you buy over the counter? Is it any more effective, or is it as good?
Yeah, that's a great question. It actually tends to be a little bit more effective because it's a longer acting medication. So, the short answer is it's basically, the big brother or sister of ibuprofen, and can be very effective for the treatment of arthritic pains. Another option is meloxicam, very similar to Celebrex, maybe some less side effect profile. So that's typically what I prescribe. But again, something to discuss with your primary care before, you start going and taking all this stuff.
Yes.
I think Jessica had a question as well.
Yeah, I have a couple of questions. So my husband had 3 years ago had 4 spontaneous compression fractures in his back without falling. So that was kind of a shock to us because he was in really good shape. And I wondered, number one, what would cause that? He has osteoporosis, which is unusual with men. He's on a medication for that, but is there and he has peripheral neuropathy in his feet now also. So is there, other than the remedies that you were talking about, is there anything else that he might do to help because he has chronic back pain?
Yeah. Again, outside of what so first of all, the cause of why he has osteoporosis, it's hard to say. It can be, we most often see, those types of issues in postmenopausal women over the age of 50. But certainly it happens in males. There could be a genetic kind of thing there. Sometimes different medications can affect your bone quality, and different what we call endocrinopathies. If you have high thyroid levels, high parathyroid levels, that can affect your bone quality as well. So just make sure, if he hasn't had that kind of full workup, which it sounds like he probably has, just make sure that they've done that. And then he's on a good medication, most importantly, to prevent the bone quality from getting worse. Because spine aside, if the bone quality is not great and he has a fall, that means, his hip can break, his wrist can break, his shoulder can break. And those are bad days, spine aside. As far as kind of for the management of back pain. And the one other thing that I'll say about bone health is that Unfortunately, I feel like and I don't know if it's just Phoenix in general, but I feel like we're a little bit behind on the 8 ball here in terms of managing bone health. So just make sure that you really push your primary care to get your husband to a good endocrinologist or rheumatologist that deals with that. As far as the management of back pain, again, sometimes if you've got, beat up back, that's kind of under, had 4 compression fractures and you're doing everything that we've already talked about and it's just not getting better. It's not where, you want it to be. Then that's where, pain management, like a good pain physician can be helpful in kind of helping to, at least get the pain levels down. So different injections and that sort of thing. Again, if he's really tried some of these other strategies. So that's where the pain guys can be very, very beneficial in that regard. In general, spine surgery for people that have, pretty bad bone quality and essentially like, 4 or 5 levels of disease. You're looking at a pretty major spine surgery for that. I'd have to put a bunch of screws and rods in the back in general, again, without knowing his full history. And I wouldn't really recommend that in somebody like that. So.
Okay, I think Jessica has one more question and Ms. Cornwall has a question.
Sorry. Yeah, and we that actually is encouraging because we have an endocrinologist and we've done the parathyroid and all of the workups. He's on a separate medication, but he also had 4 kyphoplasties. Do they, in the long term, do they affect bones around it? And can that be damaging?
Yeah. And so that, again, it just goes back to the, my kind of philosophy that, just because it's minimally invasive doesn't mean it's necessarily good. There are consequences to everything that we do to the spine. So if I touch your spine at all with any procedure, it's going to potentially cause downstream effects. And we see that with kyphoplasty. So now that those bones are, essentially now rock hard, the bones above and below are at higher risk of breaking. And we see that. But that being said, again, make sure that, the endocrinologist is doing everything they can to keep his bone quality as good as possible. Make sure he stays physically active and does some kind of weightlifting, light weightlifting here and there to try to keep those bones as strong as possible. But to your point, yes, kyphoplasty does increase the risk of the what we call the adjacent levels, the levels above or below of failing now. So
Thank you.
You're welcome.
Okay, Mrs. Cornwall, did you want to unmute yourself or Joyce can unmute you and you can ask your question?
Yes, I was just wondering, how do you determine if the neuropathy is caused by a back problem?
Good question.
Yeah, no, it's a good question. And it's just by talking to you, if you came in, I talked to you, kind of get a sense of where the neuropathy is, when it happens, examine you, test your muscle strength, test your sensation. That's really 90% of kind of figuring out where it's coming from. And then we use the MRI to kind of see, okay, well, do you have any evidence of nerve pinching in the low back or the neck or wherever it may be that would explain some of the nerve symptoms that you're having? And then if we don't see that, then sometimes what we'll do is we'll order like a nerve study. Essentially what that is, it's almost like we put a bunch of acupuncture needles in your arms or legs and they test the kind of status of the nerves. They basically run a current through your nerves to see kind of where the issue is with the nerves themselves. And then usually by that point, we kind of have a good sense of, okay, is the neuropathy coming from, the spine or is it coming from another issue altogether?
Okay, so is that something like that you do yourself? Or do you see?
In terms of the nerve study or?
Right.
Yeah, so normally the neurologist or the physiatrist would do that. We'd send, even your primary care could set you up with a nerve study if that's something that, they feel is warranted. But occasionally, we'll have people that come into our clinic, with the thought that, whatever nerve symptoms they're having is related to the spine. And I say, well, wait a second, I don't think that's the case. let's order a nerve study, and then I'll send that individual to the neurologist. But I myself do not perform that test. I rely on our neurology colleagues for that.
Okay, thank you.
You're welcome.
Well, thank you, Dr. Chung. How interesting. I learned a lot of new phrases today. I love motion is lotion. I even wrote them down.
I think I stole that from somebody else, so I can't claim
Well,
credit.
that's okay. And back attack. We've talked about heart attack and brain attack. Now I have a back attack thing.
That is mine. I did make that one up. I don't know. I'm going to claim credit for that, but motion is lotion. I can't claim credit for that.
Absolutely. Well, this is a great segue into just again thanking the people on the call today and those who cannot be here today. Your kind and generous and faithful support is really what builds out these beautiful hospitals. Del Webb and Boswell funds the best equipment that attracts physicians and surgeons the caliber of Dr. Chung. They come here because of that. The first time I met Dr. Chung and I told him the Sun Health story, he said, "This is incredible. I've never heard of a story like this." And the culture of philanthropy from this community for 50 years is just amazing. So again, hats off to all of you who dialed in today and those who were not able to. This is a great segue because, as you know, we have been working very hard on our Generosity for Generations campaign, and I'm happy to share that the community stepped up in such a generous way that we exceeded the $48 million goal by 10%. So we came in at 52 million, and there's still folks who are wanting to step in and do even more. It just demonstrates the spirit of philanthropy in this community. It also tells you these great services are here for the community because of the community. So we've got some great events coming up. We have coffees with Gina and more, so please mark your calendars. This next slide shows you the Smart Giving workshops, and we're doing this in the Southwest Valley. We have one next week on March the 21st. A goal without a plan is just a wish. And Mary Kavanaugh Marsh is new on our board of trustees, and she's a financial advisor with Edward Jones. And then the following month, on April the 13th, we have Garrett Alexa, who is a member of our Council of Professional Advisors, making a presentation on Make 2023 your best tax year ever. And then on the 15th of April, Tax Day, we have our annual fundraiser to support cancer. It's the charity golf day over at Top Golf. I am not a golfer, but I love this event. It is so fun. And for some of you, we are going to put IRS on the golf balls so that when you hit them, you're feeling just great about that. So take note, it's a very, very fun event. We have a lot of physicians who come to this and support it as well. Upcoming coffee with Gina and Friends, we have so Dr. Walkwee, who is with Banner MD Anderson Cancer Center, has specialty in esophageal cancer. He's going to be presenting on the cancer that's tough to swallow, facts about esophageal cancer. He's incredible. He's just a wonderful physician, very caring. And then on May the 3rd, Jason Schechterly, you may remember the story of Mr. Schechterly. He was a police officer who was burned over 40% of his body on a call. And he has really, really been resilient, and he has a wonderful story to tell and some information about the ultimate representation and journey of resiliency. We hope that you'll come to that. I think it's at Grandview, is that correct? Over at Grandview Terrace. And the time on that is, what? 9 a.m. Okay, thank you. And then in the fall, we have our 5K walk for women's health. It will be supporting diabetes prevention and management. It's at the Surprise Stadium starting at 7:30 in the morning. I'm not a runner or a walker, but I really love this event because it just gets us out and about with everybody. So with that, I just want to be mindful of your time. Thank you to everybody for dialing in. We welcome your feedback for these coffees. Please share your thoughts. A lot of these wonderful topics have come to us based on your recommendations and suggestions that we invite a specialist to come in and talk about something like what you heard today. So ideas for the future are always welcome. Keep those great ideas coming. And from all of us at Sun Health Foundation, I speak for many in the community when I thank you for your support and for your participation and for everything you do to make our community a better place. So with that, I'd like to sign off and say, please continue to stay well, stay safe, and stay connected. And for those of you celebrating St. Patrick's Day tomorrow, may the luck of the Irish be with you. Thank you. Bye-bye. See ya.
Thank you.
Thank you.
Oh, the green beer. Yeah, there you go. It's like my college days. Whew. Thank you. Bye-bye.
Bye.